So welcome, everyone. Thank you so much for being here. Before I introduce our speaker for today, let me just make a few announcements. This session is being recorded, just so that you're aware of that. The food is all vegan. After the talk, there will be time for Q&A, time for us to engage with our speaker. And I definitely want to thank our co-sponsors. So in addition to the Law, Ethics, and Animals program, this event is also being sponsored by the Yale Animal Law Society, the Yale Environmental Law Association, and the Yale Sustainable Food Program. So it's such a privilege to have the chance to introduce our speaker today, who has been an intellectual inspiration and a dear friend of our program for several years now. Maneesha Deckha is professor and Lansdowne chair at the Faculty of Law at the University of Victoria, where she also directs the Animals and Society Research Initiative. Her scholarly interests are breathtakingly expansive and include animal legal studies, critical animal studies, feminist animal care theory, as well as feminist analysis of law, socio-legal studies, and reproductive and end-of-life ethics. She's one of the most prodigiously productive scholars I've ever known and has published widely in law journals in Canada, the US, and the UK, as well as in numerous edited collections and leading academic journals in other disciplines. Professor Deckha's book, Animals as Legal Beings, Contesting Anthropocentric Legal Orders, has been heralded by one reviewer as a, quote, must-read for anyone who cares about more than humans, a book that, in the words of another reviewer, must be confronted by anyone seriously concerned with the legal status of animals. In the words of this reader, Animals as Legal Beings is one of a small number of works from Peter Singer on to today that simply must be included on any essential list of readings for anyone interested in the moral and legal status of non-human animals. Today, Professor Deckha will be speaking with us on the topic of animal experimentation, and will be bringing her extraordinary ability to both synthesize and make legible a complex field, and also to render that field simultaneously a bit more troubled due to the failings and implications that Maneesha almost uniquely is able to perceive. So without further ado, please provide a warm welcome to Professor Deckha.
Oh my goodness, thank you so much, Doug, for that very kind and generous introduction. And thank you so much to Lori and Vivica and everyone at LEAT for facilitating my visit here today so warmly. And also thank you to the co-sponsors as well. I am so thrilled and delighted to be here. I first visited the campus as a law student myself in 1998 for the then 10th anniversary conference for critical race theory. And it's a pleasure to come back all these years later to present an analysis that stems from my study leave year abroad last year in Switzerland, where there's quite a political and legal momentum for thinking of how to transition away from animal research. So I'm going to talk today about contemporary messaging by a segment of the pro-animal research community, which are national public funders who fund this research, and how they justify animal research in the face of the multiple critiques, but especially the rise of what are seen as new technologies that are more human relevant and increasingly obviate the need for human research, animal research. An example of which might be the announcement today about the Chemistry Nobel Prize for work involving AI proteins. So I would like to argue that the messaging still relies on a justificatory narrative about human health, that we still have to conduct animal research, even in the face of these new approach methodologies, because doing otherwise at this time, when the science is not yet ready to totally dispense with animals, is important to human health. And what I want to contest is what I argue is a selective kind of presentation of human health, one that suggests that all humans stand to benefit evenly from animal research, when I think it is fair to represent that it's a much more differentiated impact. I say that because if we look at gendered and other social hierarchies and how they affect research, design, and funding choices. And certainly if we look beyond research, design, and funding choices and think of the social and structural determinants of health, it is a fair representation to suggest that animal research really benefits at a highly disproportionate level those of us who are in the global north and can be considered part of the global elite. And so I want to question the even representation as one that is uneven and should be considered as such that we can think of the ongoing investment and funding of animal experimentation as an inequitable practice and a non-inclusive one. Of course for animals, but here on the human sphere. So to kind of give you some background about the project that might help situate this particular argument, I'd like to just talk about some of the work I was doing in Switzerland and the conversation there, and then go into more detail about the representations that I see national public funders making about the continued need for animal experimentation, and then to follow up with some examples about the social and structural determinants of health and the statistics therein, where we can see surmise a strong lack of correlation between investing in animal experimentation and addressing health outcomes for those who are really affected by social and structural determinants of health. So let me just start off by the background in case the current conversation about animal experimentation is not too familiar. I was very fortunate to be a visiting professor at the University of Zurich, Faculty of Law, affiliated there at the Center for Animal Law and Ethics under the co-direction of Professor Margot Michel, my gracious host. Professor Michel and the center are recipients of research funds from the Swiss National Science Foundation, so the main public funder in Switzerland, through something called a National Research Priority Program called Advancing the 3 Rs. So there's a research priority program in Switzerland on advancing the 3 Rs, and the 3 Rs is a long-standing animal experimentation type of best practices paradigm that has been in place, first launched or suggested by 2 British researchers 65 years ago, and has become globally ascendant in the world since then in the animal researching community and in terms of holding sway and influence with public funders, national funders. So what are the 3 Rs? First, to replace animals in research where necessary. Second, to reduce numbers where possible. To replace where possible, to reduce where possible, and then to refine techniques. So to subject animals to less intrusive, less painful experimentation where that is possible. And so despite the now decades-old entrenchment of the 3 Rs approach, I think it's fair to say, as quite a substantial segment of the literature argues, that the 3 Rs have had moderate effect at best and perhaps negligible or minimal effect at worst in terms of reducing the number of animals, certainly in terms of replacing and even in refining techniques. And so we can see this even in Switzerland. And I say even in Switzerland because Switzerland, as we may know, is comparatively quite animal forward. It was the first country to recognize animal dignity in its constitution decades ago. It is also one of the rare jurisdictions that has actually legislated the 3 Rs into law, such that the 3 Rs are not just aspirational or policies or guidelines or best practices, but actually part of animal experimentation law in Switzerland, where researchers must do a harm-benefit analysis that is demonstrated and proven to a supervisory committee. And also, there's a very active public discourse about animal experimentation. It's a very direct democratic political system in Switzerland, and there have been 4 attempts by citizens to bring about legislative change, as the democratic system there allows, through plebiscites and votes on actually partially banning animal experimentation or totally banning experimentation in Switzerland. All of those have failed, but have given risen to public discourse and has now resulted in something like a national research priority program on advancing the 3 Rs, bringing more of a rapprochement, conversation between researchers who still wish to use traditional methods and the segment of the public that lodges a sustained critique against the practice. And so what is that sustained critique? One is, of course, the long-standing critique. Animal experimentation has been debated for a long, long time, that animals are suffering, right? And the suffering is objectionable just for that. It's a moral defect to cause animals to suffer, to position humans as above animals, and to make them sacrificial for our purposes. So that long-standing critique is there. But more people are also aware now of the kind of dismal, fair to say, poor translation rates of testing on animals and having any results actually apply to humans. And so we are, repeatedly told that animal experimentation is good for human health, we must do it, but we're not told about the fact that, for example, 90% of drugs fail in clinical trials, even though they were proven promising in the animal realm before coming to clinical trials. So increasing kind of awareness, even in the science community, of the reliability and reproducibility crisis in continuing to use traditional methods, and traditional methods that have been with us now for centuries. And then, of course, that critique is compounded by the fact that we have these human relevant methods, what are called human relevant methods, because they don't involve animals. They get to have a more direct relation to humans because they're actually using human cells or mathematical or computational models or AI or robots to figure out what we have always just traditionally normatively used animal models to figure out. So these in vitro, in chemical, in silico models are often called new approach methodologies, or just simply non-animal methods or new alternative models. And so what I want to say doesn't discount any of those prongs of critique. I seek to build on them. What I find interesting and even curious is that the critique that animal experimentation is actually a non-inclusive practice when you look at it in terms of who is actually benefiting or standing to benefit, if we take various literatures and bring them together, is not part typically of this normal critique today against animal experimentation. So I want to develop that argumentation, and this is one of the focal contributions of this type of analysis. So now that we're situated knowing about the 3 Rs, about numbers, kind of staying the same, even in a country like Switzerland, for example, where numbers are either stagnating or even increasing slightly, and in the last 10 years, despite all those animal protection measures, you had a continual increase in the number of animals used in what are known in Switzerland as category 3 experiments of severe pain experiments, right? So that kind of sets us up to then understand why people want to accelerate a transition. So now I want to turn to thinking more about the representations that are made by national public funders. And I think it's important to look at countries where the main public funders are obviously cognizant of these crises in reliability and reproducibility and the growth of new approach methodologies, and want to and have some appetite for transitioning away, like the United States, and have made some inroads and dramatic inroads in that space compared to what was before. But then to consider how even with that type of appetite and attitudinal openness to a transition eventually, or at least partly eventually, there is still an insistence that we have to continue with animal research because it benefits human health, and human health is presented as an undifferentiated mass. Right? So if we take a look at the National Institutes of Health, for example, in the United States, we can see that type of messaging. And of course, it's unknown what the precise exact numbers of animals used in experiments are around the world because of transparency issues, both private sector and public sector. But we can surmise that the United States and the National Institutes of Health is the largest public funder of animal research in its jurisdiction, as well as outside in terms of supporting projects in other countries. So looking at what the NIH says about the continued need for animal research in the face of the rise of NAMs, new approach methodologies, I think is instructive just generally. And so here I just did a sampling of, the very public messaging, going to the website, seeing what the public is told on the main page about animals in research, clicking on sub-pages about why animals are used in research, how animals help to improve public health, why properly designed experiments are critical to animal research and advancing public health, ensuring the care of research animals, adoption of laboratory animals into research, and when are alternatives to animals used in research. These are all sub-pages that the public can go to and learn more about what the NIH is saying. And it's fair to come away from all that material characterizing it as one that tells the public that animal models are unique, important, critical, essential, integral. These are the adjectives that are used. Why? Because they advance human health. There's only one spot that I could glean where we have some type of differentiation about the humans who are benefiting, who are standing to benefit, and that's when the website talks about Americans, but then quickly follows that with, and also effects going to the rest of the world. So it's a very undifferentiated image of human health that is suggested. Let me just read to you the subpage where they talk about the new approach methodologies. And as you may know, following a working group report, the NIH just started a new fund, I think it's the acronym is CARRY, for complementing animal research and experimentation to help accelerate the development and the validity of new approach methodologies. So definitely an appetite and a willingness to explore that further. And on the website it says the NIH is, quote, committed to continuing to develop non-animal model alternative methods, and indeed is investing in them. But at the bottom of all that representation, even about this very new fund for researchers who are using NAMs, it says, though these alternative approaches exist and advances are being made every day, research with animals continues to be essential for understanding human diseases, biological processes, and developing treatments. Alternative approaches cannot completely replace the use of animals at this time. The alternatives simply cannot accurately replicate or model all the biologic and behavioral aspects of human disease. Until that time, animal models will remain integral for life-saving NIH-supported research. So that's a really strong correlation that's being asserted between the ability of animal using science to generate essential knowledge that will be life-saving, not that may even be life-saving. Of course, there's an openness to change, but we see that, again, the justificatory narrative is one of human health, and it's an undifferentiated representation. And of course, the NIH is not alone in this type of representation. We can go to other global centers where we have active interest in at least a partial, if not fuller, transition away from animal using science. If we go to the European Union and to national countries in Europe, we will see similar types of representations. And the EU is very interesting because, as you may know, it was in 2010 that a European Union directive was passed that talked about the need to replace animals in research. And then several years later, you had a European parliamentary resolution that noted that no such little progress, if any progress, has been made since that directive in terms of actually accelerating a transition. The numbers are actually rising in certain countries, although decreasing in some countries. The number of animals in painful experiments seems to be rising, and that there are even animals that are bred for the purposes of being used for research that never are, and are just wasted and killed at the end of the day. So again, a lot of critique in that region about animal experimentation. Yet, even in the European Union, you will see the Commission and the Parliament talk about, yes, the new approach methodologies are rising, and that's wonderful. But we still need to use animal research to take care of human health in this undifferentiated way. If we turn to countries that are really seen, globally as progressive on a range of issues, including animals, we will see this type of representation. Let me just read to you from the Swedish Research Council that says, the Swedish Research Council agrees that we need goals, plans, and processes to enable testing on animals that may cause suffering to the animal to be phased out. However, this work requires in-depth consequence analysis and clear mandates, as well as considerable resources for research aimed at finding methods that can replace testing on animals. Without these, the phase-out risks being done at the expense of the health and well-being of humans and animals. So in Europe, in addition to human health, you do get a mention of animal health, which we might think is really either perverse or sincere, and you get a mention about the environment, right? So many of the countries in Europe say it's human health, animal health, and environment, with human health really listed first. Switzerland, the same Swiss National Science Foundation that is funding 20 million Swiss francs in this national research program for advancing the 3 Rs, also has a message on the website about the support for continuation with animal models for human health. And I think what's most notable, if there's one country that we can elevate for being perhaps the most committed to transitioning away from animal research and is an animal research using country at a high level, it's the Netherlands. So they had proposed to be free of animal research as of 2025. That commitment was rolled back, but they the government has set up, in consultation with a range of stakeholders, a transition program for innovation that is free of animal models, and there's a video that the public can consume which mentions human health, animal health, and environment as a continued need. It's really open to change, this video. I don't want to underestimate how much in the Netherlands is talking about getting away from animal research. It's still an undifferentiated type of humanity is suggested as the reason we need to go forward. So all of that to say is that it's fair to characterize the communications from national funders and countries that are very open to transitioning away, at least partly, if not fully, as still upholding a justificatory narrative of an undifferentiated humanity, which lets the reader infer easily that all humans stand to benefit relatively equally from animal experimentation. I now want to turn to the part of the analysis that suggests that this is a selective presentation or representation, and a fair representation would at least acknowledge some of the likely differentiated impacts of who stands to benefit more and who stands to benefit considerably more. So, so I'm going to talk now about differentiated impacts, and none of this is to say that animal experimentation has not been globally beneficial to humans in the past, or it has, or that animal experimentation has not been, in the current era, in recent years, or even today, globally beneficial to some humans who are living in under-resourced, underserved, and underrepresented communities in the healthcare field, or in larger public policy about how society should be governed. We can think of a recent example published in Science of a new antimalarial drug generated by the Neglected Disease Drug Initiative in concert with researchers, I think even here at Yale and elsewhere, as one example of animal using research, their mosquitoes, to develop new drugs that are targeted at individuals living in situations of extreme vulnerability in the global south. But that there may be some benefits, or that some benefits may trickle down, doesn't make for a research and design landscape that is equitable. And I say this because if we look at how social hierarchies affect research and funding choices, and then if we even broaden our perspective to look at the social and structural determinants of health, the reasonable conclusion is that animal experimentation is really most beneficial to those who aren't in these positions of precarity and vulnerability in the United States, domestically, and certainly in the global South. So I'd like to just give two examples of this, talking about women, the situation here in Canada and the United States in terms of gendered impacts, and then to consider individuals living in quite severe socioeconomic disadvantage in the global South. Okay, so talking about women, none of the communications suggest there's a gendered impact from funding for animal experimentation or the results that come from it. But we know from feminist analysis in the health sciences field and a recent special issue in the social sciences medicine, co-sponsored by the National Institutes of Health, brings out a lot of these points. We know that there are gendered impacts. One way to understand this is to consider what is not normally considered the ostensible sex of animals that are used in animal research, and then to consider who is used in human clinical trials. And that would be male bodies in both, and then men in the human clinical trials. And so then this has the effect of limiting the results from any animal experimentation that are applicable to women. Another way to consider this is to see the NIH or other public funding for research on diseases and illnesses that are seen as women's diseases or illnesses. And as one article in that special issue notes, recent stats about funding show that the funding for women's diseases has stayed relatively stagnant, where overall NIH funding has gone up by 1/3 for all types of investigations into various disease and illnesses. And so this type of gendered impact is not new, as authors in this special issue and before that also have argued that we can attribute at least some of this to the masculinist culture of science in the first place. The idea that science is this epistemic authority that we cannot question comes from this belief in objectivity, this belief in value neutrality that affects who goes into science, who becomes prominent and influential, who sits on the peer review committees, who says what's important in the competitions, and then what type of research is ultimately funded. All of this has been argued to have an effect that disadvantages what women are receiving from any type of research investment, which we can surmise will then involve animal experimentation. So, and this is one example of structural sexism, right? And while it's important indeed to look at structural sexism, I would suggest that we have to look broader into the social and structural determinants of health beyond research design and funding choices, as important as that field is, to really consider how animal experimentation is not serving women very well. And when we think of things, even on a domestic level, in a country like the United States or my home country, Canada, we would be mindful of the general cultural acceptance of gender-based violence, of the ongoing violence against women that women experience, of erosion of reproductive rights, more acute in certain areas than in others, but certainly still an issue in many, many countries, especially the United States, the kind of pervasive inequities in employment, the unfair exploitation of women's labor in the home, the compromised autonomy and decision-making from these family structures, from public structures that devalue women's opinion. All of these are social determinants of health, right, that have been proven to impact women's health. And it's difficult to see the correlation between investing in animal experimentation and addressing these types of social and structural determinants, is what I'm suggesting. At the most, we would say there's a very attenuated link, but not a more direct link. And if we contemplate social and structural determinants for women who are living in real conditions of precarity and vulnerability, either within a country like the United States or in also Canada or globally, these effects are even further amplified. So let me turn to considering some of the statistics and just a fraction of the landscape about the global South in this way. I think there are multiple ways we can come at thinking about how the health needs of those in the global south and what animal research is attending to are a mismatch. Right? So the first way to do it is to think, which are the countries that are the highest animal researching countries, and who are the wealthiest countries? And one study of 2015 plotted what are the top animal researching countries. And at that time, it was China, Japan, and the United States. And we can also observe that China, Japan, and the United States are among the world's national economies. Another way to come at the figures is to consider who is in the top 10 and how many of those countries are global north countries. And as of 2015, 8 out of the 10 were global north countries, which is China and Brazil as being in the top 10 of animal researching countries that are not classified by the World Bank as high income, but they are classified as upper and middle income countries. Even another way is to consider the G7. Are they all in the top 10? Yes, they are, except for Italy. So I don't think it's a surprise that we see a very tight correlation between the richest nations in the world and the nations who are most active in the animal experimentation space. If we consider the enormous cost of animal experimentation, that just stands to make sense. But we can also consider other types of statistics to get at this correlation between animal experimentation and wealth, and the likelihood that the animal experimentation that is occurring in these rich countries are intended to benefit globally elite individuals in those countries. We may have heard of something called the 1090 research gap, which gives us a sense that the global funding of healthcare resources, 90% are invested in the diseases that are seen to afflict the wealthiest 10% of humanity. Right? So that type of disparity is well known, and if we are willing to infer that what is invested and funded with those 90% serving 10% of the global elite of humans on this earth, and that experimentation involves animals, we will be able to make the connections as well. So, of course, there are going to be outliers and some trickle-down effects. So we may think of drug provision, right, where the drug is developed with the intended lucrative market, for-profit market in mind, in terms of countries with robust healthcare systems that pay for it, or private health insurers and individuals who are able to pay for this. And eventually, the benefits of that drug will go to other spots in the world where there isn't that type of income. And certainly, I think there have been inroads made in this space over the last decades through these private partnerships that have developed. Yet, again, if we just look at access to drugs that have been around for a while in the global north and now are more accessible to the global south, or if we just focus on research, design, and funding, we are missing a lot of the picture. If we turn our attention to the social and structural determinants of health, again, beyond access to drugs, we know that there are real issues that don't seem well served by more animal experimentation, but rather would seem well served by more investment in infrastructures that can address the social and structural determinants. So common social determinants of health in the global south, of course, are lack of housing, employment opportunities, educational opportunities, just basic social supports, access to clean water, access to clean hygiene, structural determinants of political systems, how public are they, how trustworthy are they, environmental issues now with climate catastrophes and who are burdened by those differentiated impacts. All of that has been shown to disproportionately burden those living in conditions of poverty and extreme inequality in the global south. And just to take one example, we can look at the situation of children in that space. As Bill Gates, I think, has recently said through his foundation, people often ask him, what problem would you solve if you could? And he said he would solve malnutrition. And the point becomes particularly acute if you look at child malnutrition. On this point, it's instructive to maybe turn to a recent report by the UN interagency group on child mortality estimation, which earlier in the spring published a report with figures up to 2022, telling us that 148 million children in the world today still experience a type of malnutrition called stunting, where their development is stunted because they're not getting proper nutrition, and 45 million experience such to a degree that it's called wasting. Except for Afghanistan, the countries that are in the top 20 of the highest infant mortality rate, according to the report, are all in Africa. And then if we consider their statistics of preventable deaths just with basic nutrition, the estimation is that 7 million children, are dying unnecessarily, even though there have been inroads in reducing kind of child mortality in these countries. So let me again just read you one of the stats. A child born in sub-Saharan Africa is on average 18 times more likely to die before turning 5 than one born in the region of Australia and New Zealand. And while the risk of death among those younger than 5 in the highest mortality country is getting better, it's still 80 times that of the lowest mortality country. When children are born into the poorest households or fragile and conflict-affected setting, and of course we can think of Gaza and Lebanon and other places in the Middle East and other places in the world, of what children are experiencing and how they are dying, their chances of survival plummet. And so I don't think the answer to this, if we really want to be effective with intervention, is to do more animal research because it benefits humanity. If we were really looking at these health needs and what are the most dire health consequences for the planet, we would be investing in social structure in terms of health. But that's not my argument today. My argument is to merely suggest, to argue that the representation that animal experimentation, old methods, long-standing methods from centuries ago, are still needed in the face of new technologies because it benefits human health undifferentiated, is not a candid representation, obscuring these stark and quite profound global health inequities. And the report goes on to say, we know how to save children's lives by scaling up high-impact interventions, such as skilled health personnel at birth, care for small and sick newborns, antenatal and postnatal care, preventative services such as vaccination, improved access to diagnosis and treatment, right? And while some of those factors will have involved animal research to come to fruition in the past, they're not involving that to come to fruition today for this malnutrition problem, right? The knowledge is there, it's just access and the resources to fund it. So let me now conclude to leave some time for questions and exchange. What I have been arguing is that the representations about human health on which national public funders open to transitioning away from animal research, at least partly, if not fully, rely on a vision of human health. And this is an undifferentiated vision. It doesn't talk about, for example, the poor translation rates of animal research to human research. That's one area of selectivity. But what I want to concentrate on is what I'm arguing is a selectivity in terms of who is benefiting from the animal research action that is beneficial. Right? And because of social hierarchies and how they impact research, design, and funding choices, and because of social and structural determinants of health, a fair representation would include this information in representations of the public. Research is necessary for an undifferentiated human health. I want to conclude by suggesting what are some policy implications of the analysis. It is really uplifting for me, and I think for others, to know that there are now quite a number of active conversations at the policy and legal level about transitioning away from animal models when this was so long, kind of unquestionable, unsayable, unchallengeable. Now, given the rise of the new technologies and the somewhat, acceptance by more and more in the scientific community that the old methods don't really work, and recognizing the poor translation results, that openness is there, to the extent that some countries are really trying to think about or call for what are called phase-out plans, even though they don't yet have this in space. So examples like Netherlands, which does have more of a phase-out plan in place, or Germany, or Switzerland, for example. So when we think about policy and the eventual law that we hope will benefit, it's important, to have a diversity of perspectives and understanding of what is the current state of animal experimentation, actually who is benefiting. So I hope that this type of argument, trying to bring into the conversation more of the equitable kind of argument about, is animal experimentation really benefiting all humans evenly? If not, if there's an equity problem, if there's a non-inclusive problem in the human realm, shouldn't we talk about this more? Shouldn't that matter to how we think about this practice? So I think that is hopefully one contribution of this type of analysis. And then I think the equity and inclusiveness lens also relates to the larger field of animal rights and animal ethics. Because as you may know, especially in the space of food system change, promoting veganism, promoting plant-based diets, even knowing what we know about climate change and the need to do so, and the non-sustainability of animal-based methods, a common retort to those like myself or others who argue for more plant-based transition is that this position is, elitist, racist, culturally imperialist, and there's a stigma slapped on kind of this argument that we really need to make a food systems change as being insensitive to the interests of cultural or racial minorities, and even on a class basis. I have written a lot about this, as have others, as to why these arguments don't make sense. Just briefly, if you think of what's needed for world hunger and food sovereignty, it is not more animal-based products, right, to lead us into further unsustainability. Yet the narrative subsists, and there's a framing of animal interests as being in conflict or tension with the interests of marginalized human groups. I think is really unfortunate and has to be undone. In the space of what we eat and all the important attention that should be placed on agriculture and agricultural systems, at the same time, I think it's important to bring that type of critique to other normative practices, normative industries for animals. In the same way that Tyson might say we're feeding the world, I think we have the national funders even in a situation of regulatory capture saying we're healing the world, or we're helping the world medically with medical knowledge. And I forgot to mention that the majority of animal research is basic science research, right? And that means, there's debate about exactly what it means and how it's different. But basic science research is research that is just done for the purpose of research, with not any yet identified benefit for anything. It's for pure knowledge gain, right? So bringing the language of diversity, equity, inclusion to the space of animal experimentation, I think is important and could have possible traction for moral persuasion for those who at least are minded to think of inclusiveness in a way that it's currently not being. Because if we're going to elicit the social and cultural change that we need to scaffold any policy and legal change in this space, it will help, I think, rather than hurt, to talk about who is actually the group of humans that are benefiting the most, or considerably more, or actually much more, from the rest of humanity. Thank you so much for your attention, and I'd love to hear your questions and answers.